Hey guys, welcome to my channel. My name is Priscilla, and on this channel, we believe you are never too young to reach your full potential. I'm gonna shout out my nurse gangs here. Today I am talking about remote jobs that you can do from home as an RN. Obviously, these are things that you might have to go hunting a little bit more for, especially right now. Lots of people are looking for jobs, remote jobs during the pandemic as well. But these are some things that I was like, oh, maybe I should apply to. Yeah, I applied to a couple of them myself, just to see what's out there. You know, you never really know until you do it. So my number one remote job is insurance company nurse. So I actually knew an older nurse that worked with an insurance company. I think it was MetLife or MetLife. It was MetLife. She worked with them for about 10, 15 years from her house, and looking over different cases for that company. And it can be very, very taxing, but it can be very lucrative as she's making nurses pay. I didn't know the exact amount that she was making, but she was working from home and she's been doing it for years. So I was like, oh, you've been on this for a long time. So keep that in mind. Hit up the insurance company. You've got Blue Cross Blue Shield, MetLife. Now that I'm thinking about it, and now that I want them, they're all lost in the universe somewhere. But yeah, hit up those insurance companies, go to their careers. A lot of times they have nursing remote positions so that you can be a part of their staff as well. The second, I've spoken about this before, it's called a triage nurse or a phone nurse, that does like late on calls or on calls stuff. On-call nurse that if the clinic is closed, you pick up and you respond to the emergency. One of the clinics that I work with, they had hired an agency that specifically dealt with all after hours on call. So obviously if you are a pregnant person or if you are just a person calling into your primary care, hey, I can't feel my right foot for some odd reason. It's tingling, but I just can't feel it. So you would call the after hour back line and they would transfer you to that nurse, and the nurse would either send you to the emergency room or transfer you to the on-call doctor that the clinic has paid for. So very, very lucrative, very, very smart to do if you want. It might be odd hours, like evenings and nights as well. You can actually go to your local hospital. So if you have a hospital in the area, like a Children's Hospital or St. John Hospital or Mercy Hospital, I know that's a really big chain. St. Alexa, somewhere, any hospital, they have those positioned in their careers. You just have to look for them because people want to do that. So if you want to do on-call triage, some of them have it that you have to be inside the hospital, but others have it that you have to just have a phone and be available and have like a landline, internet access, a laptop, phone, is what I've seen some of those jobs that are hiring for that position. Next, we have a remote case manager nurse. So a case manager essentially has a list of patients or a bunch of patients that she manages. Obviously, if it could be long-term or short-term patients, it could be pediatrics or geriatrics, or you've got your older disabled adults, people that aren't quite 100% recovered from a surgery or something like that, or if you have sat in like an OR, not OR, but if you have had a situation where you need extensive care, not just a one-stop shop, case managers will be there, advocate for you. They'll oftentimes call or work with Medicare, Medicaid, and once Medicare, Medicaid has supplemented things that you needed, they might also use Also talk to your insurance directly for things that you may need. Different things like that. Very, very helpful, very resourceful. It's definitely a daytime job, 9 to 5 type deal. You can do it remotely and you can always do it in office, but something that you can also do that. Something you can also think about when you're doing that specific job is some insurance agencies actually hire out case manager nurses to manage various different cases for medication or equipment or home care, home health, hospice, stuff like that. So get your spidey senses up if you want to do something like that. Want to still have that patient interaction, but also want to kind of like be free, be autonomous. That's something that you should think about. Next is the audit remote nurse and data advisor. So an audit nurse or data advisor is a nurse that literally goes through all death by paperwork is what I call it. One of my nursing student friends did that we had to do like a shadow thing where she shadowed a specific nurse, and we had to do like a billboard project on it. But nevertheless, she did that, and she audited medical records and medical cases that nurses wrote like their nurses notes on, and she went through and audited all that stuff out for accuracy, for like just different things that might have happened, situations and stuff like that. And it was a lot of paperwork. But she was like, it's kind of boring. It's kind of like if you're getting ready to just retire type job. Definitely lots of HIPAA stuff going on there, but you're analyzing data, patients that might have signed out AMA or signed out without official discharges, reasoning why, patients that don't follow up on their appointments or don't follow up for surgery, patients that, just don't have the resources or just don't have the access or availability to come back to the specific hospital, out of state people and stuff like that. So very, very, very detail orientated and lots of paperwork. So if you're a reader, if you like to analyze stuff, if you like to analyze notes, data, this might be the job for you. However, that's not my cup of tea. But you can do that if you would like. Next I have is nursing consult. So lots of legal or a legal nurse or something like that. Insurance agencies, legal companies, oftentimes consult nurses for their knowledge and their judgment. So if you've been an ICU nurse for 10 years, you can do something like that. Or if you have a very good knowledge base on nurses' scope of practice within your state, you can be a nurse consult. It doesn't always have to be legally. It can also be for insurance. It could be for hospitals. You can be freelance, but you can also work for a company if you so desire. So that's another thing that you can keep in mind if you would like. And lastly is a health insurance salesperson. So if you are good with talking to people, or if you're good at selling stuff, it's really a lucrative career actually. If you can talk on the phone, this job is a really good job for you. You can make up to 6 figures as a nurse, selling, medical. These doggies. Boys, I'm trying to make a video. Stop it. If you are a nurse, if you're a nurse that is really good with words, really passionate about certain medications, sometimes it's holistic, sometimes it's a good rep that I've spoken to was a birth control rep, and she was a nurse or is a nurse, and she really believed in the birth control that she was trying to sell. our facility. And she was really, I mean, she was making bank. Like the pharmacological agencies and pharmacological capita, they have, they have money, especially if the product is a really good product and you have really passionate people within that area. But yes, that is all that I have for you guys. If you want any more remote job opportunities, I actually have a link in the description below, and it's this girl that I found on Instagram that does remote nursing jobs, and she's always posting them. So if you guys like this kind of stuff, you guys want to know more about it, link is in the description. I will definitely keep that you guys in mind for any other nursing remote jobs that might pop up again. But if you've made it this far, like my video, please comment, subscribe if you may, and have an awesome day. Bye.